Now, Raashi, our speaker will join us.
Shilpa, see, is she joining?
Shilpa is open, I think.
Yeah, she has joined.
There.
Yeah.
Raashi, please unmute, and your camera also on.
Hello.
Yes,
hi, Raashi.
Hi.
So good to see all of you all.
Welcome, Raashi.
Hi, welcome.
It's wonderful to see everyone.
Yes, hi.
It gives me great pleasure to welcome one of our shining stars, Raashi, or rather, Dr. Raashi Khatri Panjabi. I have known Raashi since her primary school days. She was my daughter's, Shibani were together in ABM. I recall that Raashi was a topper all the way through. Welcome, Raashi.
Thank you so much, Veena Auntie. I'm so deeply grateful for the warm welcome. I actually want to share something with all of you all. First of all, hi, Mom. So good to see you in spite of being
Shilpa?
Yes.
Raashi.
So good to see so many familiar names. I see Ranjan Auntie, I see Nilima Auntie, I see Ishdeep Auntie. My association with the Wheel Club has been, I was calculating, has been for 24 years now, because Mom and Dad were introduced to the Seacoast Rotary Club when I was in 10th grade. We came for the first time. Our first introductory meeting was when Amitabh Bachchan came to Centaur Hotel. And there's been no looking back since then. So I am very humbled and honored to be here today to talk to all of you all. So thank you for having me, Veena Auntie, and congratulations. I know the club is in very, very able hands under your guidance.
Thank you, Raashi. Now, Ishdeep, please forward the program.
Dear friends, we are very fortunate to have with us today Dr. Raashi Khatri Panjabi, speaking on Pain-Free Life. It's my pleasure to introduce her. She is the daughter of our very own Aruna Khatri and Manor Khatri, also like my own daughter, and I'm so very proud of all her achievements. Before a formal introduction, I would like to thank Dr. Raashi, along with all the doctors, nurses, healthcare workers, frontline workers, for their dedication, bravery, compassion during these insane, frightening times. Words are not enough. We are truly grateful and salute you all. Dr. Raashi Khatri Panjabi is an MD in Orofacial Pain, Headaches and Temporomandibular Disorders from Rutgers Medical School, formerly the University of Medicine and Dentistry of New Jersey, USA. She is the youngest diplomate of the American Board of Orofacial Pain and also has a fellowship in Orofacial Pain from Rutgers Medical School. Her clinical research on pain and sensory changes in HIV-positive patients has been published in acclaimed international journals, and she has lectured extensively at the International Association for the Study of Pain, International Association of Dental Research, and American Academy of Orofacial Pain. Since her return to Mumbai from US in 2009, she founded the Center of Orofacial Pain, which is the first of its kind multidisciplinary center in India. She is a consultant at PD Hinduja Hospital and Medical Research Center, Mahim, and has established its Orofacial Pain, Headache, and TMG clinic. She also consults at Mind Temple, Juhu, and Pradhan Dental Center. Over to you, Dr. Raashi. Friends, if you have any questions, queries for her, you may message me directly or Shilpa, or just put it on the chat and we will put forward for Dr. Raashi's response. Yes, welcome, very warm welcome, Dr. Raashi. Yes.
Thank you so much, Ishdeep Auntie. It's very heartwarming To see someone who saw me born at the hospital introduce me to everyone that I consider as family in any case. So thank you. I am very excited that everyone over here wants to know a little bit about pain-free living. I want to keep it as interactive and fun as possible. So I am actually going to allow you all, if you all need to, just put your hand up. I'll be able to see you all in your little windows. And we can even stop and answer any questions. Now, why I'm so excited to talk to you all, I remember many years ago when I told my parents I want to study pain. They told me, why do you want to study pain? What is there to study pain? If anybody has pain, that you just take a painkiller, right? What is the need for you to be helping anyone? And it actually got me thinking, and actually for all of us, there is not one person among us right now who enjoys pain, right? Pain is an uncomfortable feeling. It can be emotional, it can be sensory. But at the end of the day, even if we don't enjoy pain, pain is the one common symptom that we all have felt at some point in our life. It could have been a backache, a headache, a stomach ache, body ache. But at the end of the day, the common symptom that joins all of us is pain. And unfortunately, it is the one symptom that we don't try to understand. We try to suppress it, right? If I come to any of your houses today and I tell you all, do you all have a BP machine? Maybe out of 20 people, 5 people may have a BP machine. If I ask a thermometer now, of course, because of COVID, many of you all will offer me a thermometer. But if I ask you all right now, if I come to your houses and tell you all, listen, I have a headache, can you all give me some painkiller? Literally, you all will put up a thali in front of me. You will give me varieties. You all will give me, you'll give me Amycin, Crocin, Disprin, Crocin pain relief, Crocin headache relief, Dolo 650. So all of us are hoarders of pain medication, correct? And rightfully so, because pain is not a pleasant experience. But when we land up taking painkillers, as the name says, it kills the pain, but it not necessarily looks after the source of pain. So when I decided to talk to you all about a pain-free living, what I actually wanted to tell you all was how to live a life pain-free without having to be dependent on any painkillers, right? Because none of us enjoy medication, but all of us want to be healthy. So this got me thinking too. I asked HD Panti and I asked Mom as well that when amongst all of us who are there, the women who are in Inner Wheel right now, we're all having a conversation right now. What is everyone's understanding of pain and what does everyone think is normal pain? Because I know someone amongst us may feel that, Acha, I am 70 years old, so now I'm getting jodo ke dard, ye to normal hota hai. Or someone may say, I get headaches, it's a normal headache. Someone may say, I get backaches, but it's normal. So what exactly is normal pain and is pain normal? Like I told all of you all, that pain is one commonality that all of us have experienced, right? If I tell someone who's sitting next to me that, you know, I have a headache, they understand because possibly they have also had a headache. But how many of us, if we have a headache, look for the source? And how many of us drown what our body is trying to tell us, correct? So all pain, however uncomfortable, however unpleasant, is actually our body being kind to us. It's actually our body's protection. It's actually our body being super generous, because if our body were to produce a pleasant sensation to catch our attention, none of us would really pay attention, correct? So pain is our body's beautiful way of letting us know gently that there is something that needs to be looked after. But when we don't listen gently, like a baby that's hungry, the pain intensity will keep rising to draw our attention to what needs more protection. So the importance of addressing pain is actually to learn to communicate with ourselves better and to understand our own body much better. So what at the end is pain? If I were to look at it as a clinical definition, the scientific definition of pain Pain is an unpleasant emotional experience that tells us that our body is going to have some impending injury or has already taken, or some injury is already taken place. Let me give you common examples of pain that we all have, right? Now, if I touch a hot iron, I'll immediately get pain, which will tell me, move your hand away, correct? Now, that kind of pain would be considered as acute pain. You have touched something, you have injured something, you have hurt something, your body produces pain, but along with pain, it produces swelling, redness, some loss of function, inflammation to let your body know, chalo, chalo, back off. You have managed to injure yourself. And the moment we look after that source of injury, the pain goes away, right? That is the fastest protective mechanism. So if any of us were to get a fever, say even any viral fever, not just COVID, we know body ache is something that will accompany that viral attack, because that's your body's way of letting you know that there has been some attack, there is an inflammation. But then there are so many pains which exist without there being an actual injury. You may not have had injured your back, but now there is pain without there being any noxious stimuli. There is no swelling, there is no redness, there is no loss of function, but still the pain exists. Now, this kind of pain is chronic pain, and that's what we always need to safeguard ourselves from. Chronic pain is any pain that has lasted in your body beyond few days. It could have been weeks, it could have been years, but at the end of the day, till you don't treat it, it continues its cycle in your body to let you know that it needs to be looked after. Now, so many people, I'm sure all of you all, I'm going to make my screen wide so I can see more of you all. But so many of us who are sitting here, I'm going to ask you all by show of hands, how many of you all have had headaches? Almost everybody. Many of us believe that our headaches have happened because of stress. I see some hands going up, right? Now, a lot of times we all believe, or many of us believe, that pain can happen because of stress. I'll give you all an example. Now, suppose you're sitting in Goa. People who can actually talk while I'm talking, tell me your favorite holiday destinations. Any holiday destinations, relaxing ones.
Unmute.
Yes, Goa is good.
Goa is good. Okay, so imagine you're sitting in Goa. You're looking at blue sea in front of you. You can feel white sand below your toes. There is one chilled pina colada next to you. You're taking a nice sip from it. It is hot. And you fall off the chair and you break your hand. Okay, the pain that you feel in Goa is a 9 on 10, correct? Now imagine you're sitting in Bombay. It is the 4th day of lockdown. You have to arrange for thalis to bang on your balcony. Your maid has not come. Your grandchild is in online school, which you have to make them do their studies for. And your husband walks in with the Fufa ji and the Taya ji and say, "Ye hamare saath rahenge 3 mahine ke liye." And at that time, you fall down and you break your hand. Now, your body, even though it has a lot more emotional stress at that time, will still produce a 9 on 10 pain, because the pain is your body's way of letting you know that there has been a crack in your bone. Your pain has not started because you were in a stressful condition and you looked at your hand and said, "Yeah, toot ja, tu hi mera ek sahara hai, to toot ja." Your body has pain because there is some structural change in it. How you perceive it could come, or what you feel about the pain could be influenced by your surroundings. So most pain, even if it's chronic, we always need to go like detectives looking for what has changed structurally. आपके physical body में क्या चल रहा है जो आप पहचान नहीं पाए हैं, because of which you are getting the pain. Possibly stress is worsening how you are perceiving the pain. So if you have stress, you may feel it worse, but stress has not started your pain. a lot of times if somebody has a very, very long history of pain, for example, long history of back pain, long history of headaches, we tend to blame it on stress in the absence of not knowing what has happened that the pain is going on, right? So there'll be so many people who will tell me my migraines happen when I have stress. No, your stress, your husband, your maid issues are 24/7 there in your life. Your migraines don't start because of it. Your migraines worsen because of what's going on in your emotional life. But your migraines exist because physically there is some part of your body that is crying out to you for help to let you know that protect me. I'm going to produce pain till you look after me. Therefore, the easiest way to look after your pain is to first figure out if it is acute or chronic. Like I told you, acute means कुछ injury की वजह से है, तो आप injury का source निकाल देते हैं. If it is chronic, we try to look after it by figuring out lots more things, and one of that is to figure कि कहाँ से pain आ रहा है. So I am going to ask all of you all to think of some pain that you all have experienced in your life. It could be back pain, it could be a knee pain, it could be a headache, it could be a shoulder, neck pain, anything. Now, always when we think of pain, chalo, as unpleasant as it is, we have to respect the fact that we feel as the pain is to be validated, right? Because somebody else can't see my pain doesn't make my pain any less real. See, if you had a root canal in your mouth, the dentist would take one X-ray and show you कि देखिए यहाँ पे पस भर गया है. So you also go over and say देखो पस भर गया है. So my pain is real. There is some swelling which lets you show, or other people can see that, oh, there is a swelling in mom's hand. So there is something going on. But chronic pain can often not be seen. There may be no swelling, no redness, nothing. But it is very much real because it can evade every aspect of your life. So when we are looking at chronic pain, first we have to validate yourselves, say, yes, my pain is real, I'm going to look after it. But then start going hunting to see what kind of pain you're feeling. Very often, muscular pain is felt as a deep, dull, achy, constant pain. So if somebody comes to me and says, listen, I have a migraine, but it is here and it is deep, dull, achy, heavy. No, it is not a migraine. It is actually a muscular pain which is being felt in the head. So muscular pain, always key note is deep, dull, achy, constant. And very often muscular pain is felt further away or far away from where it starts. So you could have spasms in your neck, but that muscular pain will be felt on top of your head. You could have spasms in your neck, but muscular pain may be felt in your lower back, in your arms. Now coming to nerve.
I'm muting, but Raashi is speaking on pain, so it's interesting.
Hello.
Raashi, I'll unmute everyone. You please unmute. I'm muting everyone.
Great, I've unmuted myself.
Okay.
Thank you, Shilpa. So basically, now we know what is, we know what is muscular pain. But if I had to know whether the kind of pain I have is nerve pain, then most nerve pain is felt as sharp shooting pain or burning pain or pain that comes for a few seconds and goes away. So let me give you an example of a nerve pain that we all have felt in our lives. Imagine you're sitting on the floor because you're listening to some musical concert. You get up, your foot has fallen asleep. You're trying to bring life into that foot. You start banging it on the floor and you start feeling these sharp shooting pains, right? Now that kind of sharp shooting pain is nerve pain. The pain that we feel when a asleep hand or an asleep foot comes alive again is nerve pain, right? Very often you can feel neuromuscular pain, which is a combination of both. And one kind of pain which is vascular in origin, means related to your circulation, is throbbing pain, which goes as dhak, 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 dhak. So if you had thought of a pain that you have felt in your life before or ever, now is a good time to figure out what kind of pain you had. Was it a nerve pain? Was it a muscular pain? Was it a throbbing pain? Oh yes, circulatory pain. And that's when you stop. Because imagine if you have a phone and your phone stops working. Do we go to the Vodafone tower and decide कि चल इसको आज बंद कर लेते हैं क्योंकि हमारा phone नहीं चल रहा? Or do we figure out what is wrong in the phone? At this point, please don't take a painkiller because it will be exactly like going and blowing up that Vodafone tower. Most painkillers are anti-inflammatory. They work in the presence of inflammation. They work only on acute pain. For chronic pain, you will have to figure out what is the source by first isolating what is the type of pain, muscular, nerve, throbbing, which is circulatory, or a combination of all of this. So that's the easiest way to figure out how to live a pain-free life, because if it is muscular pain, you can do something as simple as garam ka sek on that area. If it is muscular pain, stretching, physiotherapy, relaxing that muscle, opening that muscle spasm out will give you relief. So many times I see people with muscular pain, maybe muscular headache, applying ice to their neck. Ice actually contracts. It makes water which is free flowing into an ice cube. That's how much it contracts it. So muscular pain, always heat, always stretching, always trying to open the muscles. Muscular pain patients respond beautifully to yoga, which is non-bearing. Means if you have muscular pain in your shoulder, sitting and doing the dog pose or the mountain pose, absolutely terrible for your muscles. But muscular pain will open out beautifully with Shavasana or regular yoga. Now, if you have nerve pain, easy ways to look after it is to figure out where the nerve is getting impinged. So if you have nerve pain, which will be felt along till wherever that nerve is, you will have to go looking at where did that nerve start from and open it. So things like traction or nerve release works beautifully over there along with nerve medication. If there is throbbing pain, please step back and first figure out that ye throbbing, is it happening because there is increased blood flow through that area because I have injured that area? Or is that throbbing happening because there are blood pressure changes or there are hormonal changes which are leading to a change in circulation? So in all of these, once you recognize, once you have the key, which is what is the problem, it is so simple to look after yourself without having to rely on a painkiller. Because a painkiller will work as an anti-inflammatory only for the 4 hours that it's working in your body. But the moment those 4 hours are over and the level of painkillers in your bloodstream go down, your body has to communicate to you. So it will communicate again by doing what it knows best, giving you discomfort to grab your attention and tell you, look here, you still haven't looked after me adequately. I want you all to have extremely healthy, happy, well lives. There is no normal pain at any age. Having knee pain is not normal. It means that you haven't looked after the muscles which are giving support to your knee, which has led to collagen loss between your knee bones, leading to arthritis. But that is also reversible if you're willing to work at building your collagen and building your muscle strength. Our body doesn't have to age with pain. Our body is waiting for us to throw that life jacket at it so that it can repair itself, because that's what the body does. It repairs itself even in the absence of treatment. So if you get a cut on your hand, even if you just stare at it, even if it's a deep cut, the body will respond by looking after it. It may not be as fast as you want it to, but the body will look after it. We just have to guide it. And we doctors are like pretty much very overtrained traffic policemen who are going to guide you all to help make you have a healthier or a more well life. The aim is always to go from illness to wellness, right? And not to stuff ourselves with more unnecessary or unwanted medication. Well, How much time do we have? Sorry.
Veena, yeah, I think it's
We have about
4:30
minutes, 1 or 2 minutes more.
Yeah, I think that should be okay. We'll keep some time for interaction with some questions if anybody has that. Is that okay?
Yeah, okay by me.
Yeah, I don't know what is Veena saying about the meeting time. Veena, you have to unmute yourself.
Unmute yourself, Veena ji.
Raashi, you can talk for some more time.
So I wanted to share with you all a key thing about headaches now. Most of the times when I ask a large group of lovely women like yourselves that where is your head, I'm going to count 1, 2, 3 and I want everyone to just point at their heads. 1, 2, 3, point at your head.
I would say my head. Point.
Yeah. Okay, so 90% of people when I ask them where their head is, would generally tell me the area between the eyebrow and the top of the head, right? The top of the skull. But Isdipandi, you're actually absolutely correct. Your head is everything that is on your neck.
Yeah.
Is your head and not this. So any ache in this area is considered to be a headache, and most headaches often originate at the base of your skull at the back.
Yeah.
May feel as temple headache or may feel above your eyebrows, may feel at different areas. What I have noticed over many years is that, you know, in the US, in UK, anywhere else in the world, if you need any kind of medical treatment done for you, it goes through lots of clearances by insurance. But in India, if you need an MRI also, you have to just show up at the MRI center and say, karwa lo. So a lot of people who have chronic headaches actually go to, because they haven't received treatment, chronic migraines, which by the way are treatable. Migraines are completely treatable. But a lot of people who have long history of headaches eventually find themselves in a desperate situation. They get scared. What is going on? So they go and get MRIs and CT scans done to figure out. So I'm actually going to give you all 5 red flags. Now, if anyone in your family or people around you or yourself have these 5 red flags related to a headache, then get an MRI done. Don't think of the worst and get an MRI done. We generally go get MRIs and CT scans done if we are looking for growing lesions, right? We think of tumors or anything that is going on in the brain. So I'm going to give you all something which I hope is going to be life-saving for someone else. So these are the 5 red flags which everyone should remember, which will help you to save someone's life in case they complain of a headache. So if someone above the age of 45 complains of the first and worst headache, suppose somebody above 45 comes and tells you, I've never had a headache my entire life, but I'm having the worst headache for the first time in my life, do not wait to meet a doctor, go get an MRI done. Usually, a person who's describing this will also show some changes. They may tell you that I find things blurry, ya haath se cheezein chhoot rahi hai. They will have loss of nerve control, may or may not have some visual changes as well. Okay. And very often, these headaches are progressive. So if it was an 8 on 10 with movements like bending down towards the floor, not just walking, but bending down especially towards the floor, you will see these escalating. The quantity of the headache that they're feeling and the quality of the headache worsens. So these are the 5 red flags. Neurosensory changes, first and worst headache, progressive, and one which worsens because of your gravitational changes. So if anybody in your family experiences this, a quick thing to do would be to ask them to lift their hands up so you can rule out if there is a stroke happening at that time, and take them for an MRI or a CT, reach out to your doctor so it can be quickly ruled out for anything dangerous. But for any other kind of chronic headaches, whether it is migraine or tension type headaches or cluster headaches, there is treatment available and no one has to suffer. I'm very happy to help anyone from this family who has headaches for the same or chronic pain for that matter. Thank you so much for giving me a platform to share this knowledge. There's such less known about pain in India especially. It's not taught as an MD specialization yet. I'm deeply grateful that my parents trusted me and sent me to the US to study in a field that was completely unknown to them. I think I have to thank Rotary for that, because Dad and Mom met so many people who were so educated and who had such progressive views on life that they decided that that's the only way to move forward, to keep learning and to do new things for the benefit of humanity. So before I left, in fact, Papa told me that you're going, but you cannot stay back in the US and share your knowledge with them.
You have to come back.
You have to come back, because what is the sense of studying something that they already have doctors in the US for? You better come back and practice it here and help the people over here. So I think that is a value that Mom and Dad gave me from Rotary as well. So thank you for having me, and it's been an absolute honor. So
Thank you.
Any questions?
Yeah. Raashi, I can ask you, how do we get in touch with you, or do we have to get some tests done before we come and contact you, or just...
No, absolutely not, because we are all on a platform of people that I trust and love. I'm going to just share my cell phone number with all of you all.
Okay.
So my cell phone number is 9833773320, and I'll also send a picture of my visiting card to Veena Auntie and to Ishdeep Auntie. And
Yeah.
I'm happy if you want to share it on the group.
Yeah.
I'm happy to address any medical concerns that any of you all have.
Can you repeat the number once again, please?
Yes, Auntie. How are you, Nilima Auntie? So,
I'm fine. How are you?
very well. It's 98
Yeah.
33 77 3320. And the mother will certify I'm terrible at picking up phones. Please WhatsApp me in case I don't pick up the calls, because COVID is keeping us covered like astronauts at the hospital. So difficult to touch the phones in between.
No, we really appreciate, Raashi, all you've been doing, helping everyone. Yeah, very, very appreciative.
It's been a trying time, but everyone please be safe.
That's true. That's true. Yeah. Anything regarding, see, because post-menopausal, you want to touch that topic, post-menopausal and gut health. I think acidity also causes a lot of headaches.
Absolutely. So acidity is something that triggers muscular headaches greatly. What I have realized is that even with acidity, like how we say pain and we use a painkiller to kill it, even with acidity, barely any of us go looking for the cause of acidity, and instead we use antacids to constantly suppress. Now, reducing acid is a beautiful thing that our stomach does, because there's no other way for it to break down food. Right? So there are so many naturopaths who will keep advising acid short low, basically nimbu short lete jao, is adding acid to our stomach, citric acid, to break down food. The best way to avoid acidity would be, first of all, to have regular meals, of course. And if you have hyperacidity, means acidity which is beyond normal, some of the reasons why one could have hyperacidity could be related to their thyroid health. So anybody who has hyperacidity, I always ask them, go looking for what's up with your thyroid, but don't just look at your TSH values or your free T3, T4 values, because that's what we regularly do, right?
Yeah.
First, when we want to just get a test done, we go and tell them thyroid panel karwa lo. Now, that may not be the best way of addressing your thyroid issues. Always do a thyroid autoantibodies, because it will tell you if you have hidden thyroid or if you have tendencies towards thyroid. Now, acidity can also be because of changed gut microflora. Now, we all know that from our mouth to our anus, we are literally a rainforest. We have hundreds and thousands of bacteria and organisms which allow us to digest food, which allow us from tasting to swallowing to digestion to throwing out of that food. but unnecessary use of antibiotics. Now, this also again in India, we can kirane wala dukan and say tumko augmentin people carry in the purses, right? O2 people have it lying around at home. Now, every time you have a cold, every time you have a fever, taking an antibiotic is not going to work for virus. So many times in COVID, I have seen people, they've got COVID and they've started taking AZI, which is azithromycin. Now, COVID is a viral infection. Taking an antibiotic at that time is useless. But taking that antibiotic actually reduces the bios or the microbios in your gut flora. Now, when your body doesn't have the good gut bacteria, it doesn't know how to digest and will produce more acid, right? Food intolerances also can lead to hyperacidity. Not knowing what your body can tolerate and not tolerate in terms of digestion can, of course, lead to that as well. Can I mention some very freely available foods in our Indian kitchens which can actually reduce acidity?
Yes, definitely.
It is such we have to learn to go back to what we know in our kitchens. So papad and dahi, which is such a forgotten combination. You know, people would always end their meals with dahi, papad, achar.
Yeah.
Achar is full of fermented bacteria. Your papad, the dale ferment hoke banti hai, to papad ban pata hai. Yeah. Your dahi is, of course, probios in every way. Start including, but if you eat so much achar, not going to help you. Then your body will have to produce a lot of acid to break it down. So little achar. Basic things like our grandmothers used to put things in vinegar or nimbu, like putting even your onions.
Yeah.
Eating anything, please do not have raw food unnecessarily. There is this entire trend of juicing, raw vegetable juices, not always healthy for the gut. Better to have steamed or cooked food if you want to reduce acidity. Your acid is your body's helpful way of breaking down what you are putting inside that is hard to digest. So understand your body. And acid affects muscles. Muscles lead to a lot more headaches in constricted muscles. So people, when there are lots of people, you press their muscles and they start burping, right? Or people, when they get massages, they burp and they feel very embarrassed about it. But the point is, your acid is affecting your muscle health and your muscles are leading to painful burps. So first address your gut. So it's a great question that you brought up, Ishdeepanti. Gut health is primary to everything. If we can manage to look after our gut, we don't need any doctor. Your kitchen would be your clinic.
Great.
More tips?
Yes, sir. Una, let us know the time, how we're doing with time.
What everybody saying?
Can I ask a question?
Yes, yes.
Yeah, Peter.
Yeah, hi. Hi, Raashi. It was very informative a session. I just wanted to check with you. You were talking about acidity and headaches. So what would you do, because what happens is like you get acidity, I get a headache, and then, it's so unbearable that I feel, okay, let me just have a tablet, which I'm sure it's like a cyclical thing, and then I get more acidity and it just keeps increasing. Anything you can suggest to reduce, the acidity-induced headaches?
So, Arpita, I would highly recommend you to get a full body eval done. I'm happy to help you with it to figure out why you're getting the acidity and the headaches also. Because migraines, which is a hormonal headache, can also increase hyperacidity, which can lead to nausea. But acidity by itself can also give you muscular headaches. So it's always in your best interest to figure out what it is for you. Most anti-inflammatories, whether it's Bombay, anything with phlegm in it, irritates your gut lining as well. Yeah. So you go into what is known as a rebound headache. Aap ek dawai lenge, again or there are people who have chronic headaches who will also puke, who will induce puking, because the moment they puke, the body produces a natural muscle relaxant. Immediately after puking, any of us, or around our face, we feel more relaxed. because the body produces a neurotransmitter which makes all our muscles relaxed. It would be great for you in your interest to know. I'm happy to extend that to you. Just come to the clinic.
Sure.
Evaluate you to make sure that we are not treating you for something. Don't self-treat yourself.
Yeah.
For something which may not be pertinent to you. The reason why I said that to you specifically, Arpita, is because I'm presuming you're menstruating.
Yeah.
We should be ruling out hormonal headaches for you.
No, it probably is that because yes, I am in that premenopausal phase. So
correct. So we should be ruling out what hormone change has led to that for you.
Okay, so I'll come and visit you.
Please come. Happy to help.
Thanks.
Any more questions?
Yeah.
Generally, can I ask a question?
Yes, sure, Alka.
So knee pain is a very common problem lot of us have. So it could be for various reasons. It could be muscles, it could be bone loss, it could be osteoarthritis, it could be osteoporosis. So can you suggest any foods we can have? I mean, okay, it's more of a dietitian thing, but generally speaking, anything that we can avoid and if one doesn't go for surgery, supposing, then what can we do to prevent further increase in that pain for whatever reason?
It's actually a brilliant question, and it does fall under my domain as well in some part of it. I look after a lot of patients who have chronic knee pains, and to oversimplify it, but to explain it to you, our knee joint is basically, a joint is where, if you and me join, it is where we meet, right? So a knee joint is where two bones meet. Now your knee joint is a weight-bearing joint. It takes the weight of your entire upper body. And between these two joints, like in any joint of our body, between these two joints, I'm going to find something small. We have a cushion, a cartilage, right? And our bones are supported by muscles on either side. So if your muscles are relaxed, your joint moves in a particular way. If your muscles are taut, your joint moves in a particular way. That's how we are able to move. As one ages, there is muscle loss. Okay. It could be because of protein intake being low. It could be because of less resistance training. So basically you go into the zone of thinking that, Acha, I'm old, so I need to take it a little easy. Let me not use those muscles as much. So muscle loss, if there is muscle loss, the support of the joint reduces. And in any case, the joint being weight bearing, the weight is pushed upon this cartilage, which keeps getting thinner and thinner as age progresses. When it gets very thinned out, like suppose it gets extremely thinned out like paper, then the two bones start rubbing against each other, and bones rubbing against each other leads to itis of the bones. Osteo means bone, arth means the bony, the arthrosis means where the bones meet, itis, bone loss because of the two bones touching. Now, if you want to reverse this, let's be logical. Most people, I mean, I'm not giving a bad rep to doctors, but at this point, if you go to a doctor, the doctor will say, let's make you comfortable. Let's remove this knee. Let's put an artificial knee inside over here, which is not the bad way to go for most patients. But if you want to look after this non-surgically, first thing that you have to start doing is resistance training for the muscles of your legs. Simple things. On Amazon, buy 1 kg ka weight. Put it around your ankles. If these are your knees, sitting while watching TV, move your knees up and down with weights. There is the blood flow against gravity from your ankles upwards is naturally reducing. You need that resistance training for your body to recognize कि कुछ काम हो रहा है, तो मैं blood भेजूं, तो मैं बनाऊं. Correct? So resistance training is the best way to get muscles back. अगर आप लंगर में जन को बढ़ा रहे हो, तो आपको लंगर में खाना भी उनके लिए लाना पड़ेगा. So protein intake has to go. Whatever is your weight, 0.8 multiplied by 8 has to be the amount of protein you take in every single day. One bowl of dal is 4 grams of proteins. If you weigh 50 kgs, you need 42 grams of proteins a day. That means 6 bowls of dals. So if you are not getting that much, put a protein shake. That may also not be digested, but so many vegetarian protein sources, sattu ka atta, tofu, edamame, beans. Find the good protein sources that you like. If any non-vegetarians are listening right now, Bombay machi, pieces of Bombay machi, so small, so yummy, will give you 50 grams of protein.
We should start
with protein shake and also baby. Now, besides that, we have got the muscles to get healthier. We have started resistance training to get the muscles to get stronger. You need the cartilage to also be formed, correct? Swimming is the #1 way to separate bones. Swimming is like traction for the body, correct? Because underwater, we are weightless. That means our joints get stretched a lot more. If you have access to a pool at whatever age, start swimming. If you can't swim, you don't know how to swim, be on the baby side of the pool, walk till where your legs are reaching. But also, please add a collagen supplement. There are some amazing collagen supplements which are available on... See, collagen comes from animal source. Now, you and me are not going to drink paya soup 1 liter every day. It's not going to happen, correct? So these guys have dehydrated the same component which is in a paya soup. They have made it into a powder so that you put it inside a glass of water and you drink it up. I am 39 years old and I have collagen every single day because I don't want the elasticity of my skin and joints to get affected as I age. There is no age that you have to wait till for you to start collagen. Start collagen right now. Amazon is full of decent brands. Find one which is unflavored, add it to nariyal pani and have it if you need to. Add it to ginger tea and have it so that the taste is masked. But start having collagen daily, 1 scoop. Daily.
Thanks a lot. That was really helpful.
If I wanted to ask something?
No, I mean, yeah, just thanks, Raashi. It was really a wonderful session and we got to know a lot. Now, one question I have is, like, we human beings and of course we women, especially those who have given birth to a child, know, you know, labor pain. So the enduring capacity is a lot.
Yeah.
We have. So now what would your take be like? What would you work on? Like even for a slightest headache, people want to take a pill right now, which of course we don't advocate. But what would you, when you are with a patient, what would you work on? Would it be more of the techniques, of course, or even the psyche of the patient, the psychological, that if you train your mind, you can really endure whatever pain, you know, and as I said, you know, help the body, heal.
It's
so what is the percentage like? What would you?
You have given such a brilliant example, so I'm going to elaborate on that right now. You know, as women, we have been granted the boon of being happy, right? It's a privilege. But along with the endurance, pain, God has also given us something cool, which
should end it now.
Short term.
Okay, thanks.
Sorry, Raashi, I'll.
Sorry, can you hear me? Now
I can. Yeah, we can.
So I was telling you that with the boon and the endurance and the strength of having a baby, we have also been gifted with memory loss as far as pain is concerned. So none of us, no human being on planet Earth can remember previous pain.
Oh, okay.
That was the case. Nobody would have not more than one child. Right? If they would have had and I had a vaginal without epidural. Okay, and I still want a second baby. So none of us remember pain, which is amazing. Okay, that's the great India that we have. But as far as your question is concerned, we as Indian women also bear a lot. So if what I have seen is that in the Western countries, I had the privilege of working in the US for many, many years before moving in. Pain is given a lot of respect over there. So if you have pain, you will go to address it. But over here, even if you have headaches for many years, you will bear it. Either pop in a medication, even if you don't enjoy popping in medications, and you will tend to get on with life. क्योंकि headache ही तो है, दिक्कत थोड़ी है. Most women, often, even amongst ourselves, don't give that much self-care and self-love with a lot more priority to family, a lot more priority to duties and responsibilities, right? Which is why I always say you have to believe everybody's pain as being 100% their reality. Because it's only when it gets to that level is when they start seeking help. When they start looking for medical intervention is when they have taken it for far too long. And because pain cannot be seen, people tend to live through their best moments holding that burden on their heads. So I have had women who have had migraines during their child's marriage, but they don't want to, nobody can see it. So they have smiled on the stage for 5 hours while going down and calling me. So, tendency to bear is very high, but we have to stop the buck right now. We have to pass it on as a message that no need to bear pain. A, seek the right help so that you can at least understand your body and reverse it. I'm giving you the medical science where we know that now migraines can be reversed, not just managed. We can reverse it.
Wow.
People don't feel it anymore. It doesn't take away from their quality of life. Making somebody who has chronic pain pain-free gives them their life back. So I have had young patients who have gone on to write books, become actresses, done big things with their life because now they're not holding that invisible 50 kgs of a headache or a pain that stops them from living their full life. It's also very gratifying for me, which is the fun part.
Yeah, thank you, Raashi. Excellent talk, and big applause to you from all of us. Yes.
Thank you, Auntie.
We appreciate all your time that you've given us, and it was very, very helpful. And I'm sure there'll be a lot of follow-up, and we will
In the right side.
As we go ahead.
Very informative. Very
Yeah.
Thank you so much, Raashi.
Really proud of you, Raashi. Yeah.
Thank you so much for being my support system and inspiration.
Yes. Excellent. Excellent. Yeah. A big applause to Raashi.
You are bacha.
Yeah.
Reenu, please, vote of thanks.
Yeah, I just want to thanks for this lovely meeting. This is September. GBM was really wonderful, conducted by Veena, and especially with Dr. Raashi. I would say our Dr. Raashi,
Yes.
that she was able to explain us how to communicate with pain and then get a relief. And I want to thank all our members as well, and enjoy the rainy day. That is all I want to say.
Good weather. Yeah.
Monsoons, yeah. Thank you.
Thank you.
I adjourn the meeting.
Yes.
Thank you.
Thank you. Yeah. Bye-bye. Bye, everybody.
Bye, everybody.